Agape ASMR. Good afternoon, how are you doing? Great, sorry I put hand sanitizer on. So how is everything going? Good, good. Now let me just verify your name and date of birth, please. Okay. And you are here for your endocrinology checkup. Yep. Okay. So, how have your blood sugars been? Relatively normal? Okay. So, have you had many episodes where it's gone low? And by low, I mean, below 82. Maybe 2 times a week? Okay. Alright, and what are your symptoms when that happens? Okay. Tingly. Your mouth gets numb? Okay. Alright. And then, how often are your blood sugars elevated? I would say, 180, 200. Okay. So they are probably about 2 times a day. Okay. Now, flipping through your chart and your graph that we have uploaded, that comes after dinner time and after lunchtime. So are you bolusing? Okay. Not bolusing? Okay. And with the Humalog that you're on, with the insulin pump, you need to bolus about 15 minutes before you eat. Okay. And how are you with your carb counting? Okay, you feel comfortable with it? Okay. Now, if you ever wanted us to, we could set you up with the nutritionalist. Is that something that you would like? Not at the moment? Okay, that's perfectly fine. It's just there if and when you want it, okay? Okay. Now, when your blood sugar is elevated, what are your symptoms? You're tired, okay? And headache? Okay. And you're thirsty? Okay. Alright. Just double check. Now, you said that you're going low about 2 times a week. Is there a reason for that? You're exercising? Okay. Now, you're on the Tandem T-Slim pump, correct? Let's just double check. Okay. Are you putting it on exercise mode? No? Okay. I would suggest trying that before we adjust your rates. Put it on the exercise mode and see if that's going to help alleviate some of the low blood sugars. And it might actually help, some of the high ones in case they rebound. Yeah. So how are you treating your low blood sugars? With chocolate milk? Okay. Maybe let's switch that up to like gummies, like the Welch's little packs of gummies. There's about 15 grams of carbohydrates in there, so, and 15 rolls, you eat 15 grams of carbohydrates, wait 15 minutes. You know, it's one of those packs, so it's a little bit easier to manage, bringing it up a little bit by little bit. Yeah, I know those glucose tablets are terrible, so I get it. But maybe try the gummies, that way it doesn't shoot you up so high. Okay. Alright, so it looks like we need to get your A1C. So we can do that here in the office, and then what I'll do is I'll go through our yearly endocrinology exam on you. Okay. I'm not going to adjust your basal rates just yet. I want to see how your body reacts to changing the low blood sugars. So if you do the gummies, we'll see how that goes. And then bolus, 15 minutes before lunch and dinner. Okay. Alright, so let me make a note of that. Okay, so let's get your basic results here. Let's get these gloves on. We'll start your A1C first, because that takes a few minutes for it to come back. Perhaps if I put the gloves on properly. Okay. Alright, so it doesn't matter which hand, so whichever finger you prefer. Okay. Okay, we'll go with that one. Alright, and we're just cleaning it with alcohol to make sure that everything's good. Alright, and now that dries, I'm going to open this up. Just do a quick little jab with this little needle. That turned on. Okay, are you ready? Yeah, you're a pro at this. You'll be good. Alright, 1, 2, 3. Book. Alright, perfect. So we'll get that one here. Okay. Okay, so now while that sits, I'm just going to go through our regular checkup. So I'm just going to get your temperature, your blood pressure. I am going to do your blood pressure twice. Once without the stethoscope, and then another time with the stethoscope. Okay. Yeah, first we'll get to your temp. Okay, ready? Alright. That's good. Alright. So now we're going to do your blood pressure. Okay, so now using your right wrist. So just press this over. So what I'm going to have you do is put it on your wrist, and then you're just going to pull it up over you like that. Okay. Maybe. Is it being finicky now? There we go. Oh, geez, oh, Pete's. Okay. Alright, we'll try this again. Back on your arm. There. Okay, now hold it up. Okay. And that was 120 over 83, so that's pretty good. Okay, so we're going to do it again. We're going to give your wrist a little bit of a break. And then I'm going to listen with my stethoscope while we do this. Okay. Alright, now give me your arm again. And 117 over 79. Okay. Take that from you. So your blood pressure is really good. And you're not on any blood pressure medication, correct? Okay, I didn't see it in your chart. So. Okay, so what I'm going to do now is I'm going to start with looking at your eyes. A lot of the things with diabetics is you can get diabetic retinopathy. So I just want to make sure that, you know, I'm checking on the health of your eyes. Obviously, I want you to go to an optometrist, you know, because they have the tools that are better than what mine are. So obviously make your appointments with them, and with you being a diabetic, they're going to want to see you every year. Okay, so I just want you to read off the line that you can see the best. Yeah, sorry, cover your right eye. Okay, perfect. So now cover your left. Good, good. Okay, so now I'm going to take a look in your eyes. So are you okay if I get close with you? Close to you? Okay. I have not had enough coffee today. Okay, so I'm gonna look. Okay, just look straight ahead. Perfect. Okay, now look up for me. Okay, now we can look at the other eye. Okay, and again, just look straight ahead. Okay. Alright, now look up for me. Okay. Alright, so the back of your eye looks okay to me so far. But again, the optometrist will have a little bit of a better tool than me. So now I'm going to look, pull down your eye and look at the bottom part of your eye. So just look up. Okay, and now your other eye. Okay, perfect. Okay, your eyes look healthy to me. I am going to check inside of your mouth. If I can get this thing open. The opening things aren't very good today. Alright. Okay, now open wide, go up. Good job. Okay. Everything inside of there looks good. My garbage. Okay. So we're gonna work our way down. So I'm going to check your thyroid. I know right now you don't have any thyroid issues, whether it's hypothyroidism, Graves, Hashimoto's. You currently don't have any of that. But since you do have diabetes, it's an autoimmune disorder, which you're well aware of. And so we try to be on the lookout in case you're more susceptible to get other autoimmune disorders. Especially, with endocrine system, when your pancreas goes, it's all that much harder on your thyroid. I am going to put this down for a second. That way I'm not going to be hitting it off of you. Okay, so I'm just going to be feeling around your neck. And then at one point I'm going to ask you to swallow, okay? Alright. Okay. Now can you turn your head to the right and look up? Right or left, whichever one. Doesn't matter. Okay, now can you turn the other way and look up? Okay, now look straight at me. And can you swallow? I know it's all difficult with my hands right there. Can you swallow again for me? Okay. That looks fine. I don't feel any enlargements, no quarters or anything on your thyroid. So that all is good. So I'm gonna work my way down. I want to see your hands. I know you have the Dexcom, which is a continuous glucose monitor. How often are you calibrating that? Just a couple times a week? Okay. I just want to check your fingers for the scarring on your fingertips from testing your blood sugar, and then just any other, dry skin, things like that. Okay. Alright, so give me your right hand. Okay. Okay, the other hand. Thank you. Okay, and you mainly use your pointer finger, don't you? Okay, let's try another finger. Give that one a little bit of a break. Okay, now your other hand. flip them over. Okay. I'm just gonna check your hydration. Are you drinking enough water? I could tell. Okay. Just try to get, recommended is half your body weight in ounces. I realize that's hard for some people, so just try to get, to 16.9 ounces of bottled water in to start. I get it's difficult. Yeah. Okay. So now I'm gonna go down and I'm gonna check your stomach. Do you mainly keep your sites, your insulin pump site and your Dexcom? Is that mainly in your abdomen? Oh, goodness, again, not enough coffee. You do? Okay. Now, are you rotating them? Mainly just your stomach? Okay. I get it. I do the same thing. My stomach is my favorite. So, I'm just going to check for scarring, and just making sure that the other one, the, old injection sites are healing. Okay? Can you lift up your shirt for me? Thank you. Okay. I do see some scarring. So just because of the length that you have had diabetes, when you change a site, maybe put, Neosporin on it just a little bit to help reduce some of the scarring. Yeah. Okay, I'm gonna palpate on your stomach a little bit. Just let me know if that hurts at all. No? Okay. Good? Okay. Alright, so I'm just gonna push in a little bit. Is that all okay? Okay. Okay. Alright, I am gonna listen to your breathing, and then I'm gonna listen to your stomach. Okay. So, alright, now take a deep breath in and out. Okay, just breathe normal on this one. Okay. Okay, good. I don't hear anything there. I'm going to come around behind you and listen to you there. Okay. Alright, now take a big deep breath in and out. Again. And out. One more time. And out. Okay, perfect. So everything sounds good back there. Alright, I'm going to listen to your stomach, and that's just to make sure that everything is digesting correctly. With diabetes, there's always a chance of gastroparesis, which is the slowing down of your digestion, which could cause your blood sugars to go off, have you have more lows because your insulin's working faster than the food is digesting. So that's always a precaution. Plus, it can cause stomach acid. So that's one of the things that we'll always look for and ask about. Alright, so I'm just going to listen. Okay. Okay. Everything sounds good there. Right now I'm going to test your strength. So I'm going to grab a hold of make your hands into a fist, and I'm going to push on them. And I want you to, yeah. Okay. Now the other way. Okay, perfect. Now can you squeeze my hands? Good job. Okay. So now I'm going to check your legs, check your reflexes, and then I'm gonna check your feet, okay? Alright, can you lift up your pant leg for me? Okay, thank you. Right now, I'm mainly looking for is that the blood flow is good on your legs. Again, diabetes can cause a lot of problems, circulatory issues being one of them. So I'm just checking to make sure that your legs and your feet feel warm. Okay, now I'm going to check your reflexes on your knee. Are you ready? Okay, 1, 2, perfect. Okay, now your other knee, 1, 2, good. Okay, I'm gonna check your elbow. Okay, just extend it out. Okay, perfect. Now the other one. Perfect. Okay. So I'm gonna ask you to bring your leg up, because I do need to inspect your feet. Okay. And just looking at your toes to make sure that there's no cuts in them. You don't have any calluses on the bottom of your feet. Okay, now your other foot, please. Alright. Same thing here. Everything there looks fine. No calluses on your heel. No cuts or abrasions. Okay. I'm going to do the nerve test with our filament. So I'm going to do this on your hands as well as your feet. Okay. So I want you to hold your hands out to me like this. And I want you to close your eyes. Okay. Now I want you to tell me each time you feel me touch one of your fingers. Okay? Alright. Okay. Okay, perfect. Other hand. Good. Good. Okay. So I'm going to do the same thing to your feet. So you can bring them up again. Okay. Okay, good. Good. Another one. Did you feel that one? Okay, good. Okay. You can go and put your foot down. Okay, so overall, everything is looking great. Let's check your A1C. Okay, your A1C is 7.8. I would like to get that down a little bit, so, ideally, I'd like you closer to 6. And again, if we, bolus at lunch and dinner about 15 minutes before, and then when you have a low, treat with the packet of gummies. That way it's not going to shoot you too far up. So we'll see how that works for you. And then, let me see, I think I want to see you back here in a month. And then we'll go over everything then, and then we'll make changes to your insulin pump if we need to. Okay? Well, it was a pleasure seeing you today, and I hope you have a wonderful rest of your day.